Hello, I'm Susan Roberts. I'm head of the Science Program Committee, and I welcome you to the 19th Century Charitable Association. Our mission is to strengthen our community through learning, giving, and sharing our landmark building. Our vision is to be a dynamic cultural center for community learning. This program is part of our Japan Themester programs. It's possible through a grant from the Toshiba Foundation. Besides Toshiba, we have sponsors from our organization, and we want to thank them, Susan and John Kelty and Ted and Joanne Despotes. I would like to introduce our speakers now. Jane Young is the sales manager of PARO products in the U.S., and she was instrumental in bringing his therapeutic seal to the U.S. And then we have Dr. Takanori Shibata, who is the inventor of our therapeutic seal here. And I had the luxury of being able to hold him and get my picture with him. And Dr. Shibata is the Chief Senior Research Scientist at the National Institute of Advanced Industrial Science Technology, long handle, as the acronym AIST in Japan. He's also a visiting professor of the Department of Robotics, Tohoku University, and a visiting fellow at the Age Lab at MIT. We want to welcome both Jane and Dr. Shibata.
Thank you very much. So my name is Jane, and I'm here today with Dr. Shibata to introduce PARO. So just a little bit background of myself. My work with PARO is considered very deeply personal. Like many of you, I see the challenges of a cognitive decline up close. And my grandfather passed away with dementia 3 years ago. So that's why I'm so committed to promoting PARO and just introduce PARO to those who in need, families, patients. And this is actually very dedicated research for many, many years that Dr. Shibata here is going to introduce how he has made this wonderful, gentle, loving robot. So we always wonder, can a robot really provide the same benefits, social benefits or psychological of the animal therapy? Does it really provide such same effect or anything that it could take over from us? But I think you will see this presentation in your eyes, how wonderful it is, can bring people comfort and connections, not just like, it's a robot over there. You can really talk to him and it won't judge you. And there's no, and you don't have to go for a walk, feed him, so no side effects at all. So it's gonna be a great honor for me to introduce Dr. Shibata. Please come on here.
Good afternoon, ladies and gentlemen. I'm Takanori Shibata, and it's an honor for me to be here to talk about PARO. So you can forget the title. Basically, I talk about therapeutic robot PARO. And PARO is a baby seal robot, and it's a very cute animal. Of course, when people hear about the robot, a lot of people have some negative attitude toward robot. But if you interact with PARO, you may change the concept of robot or PARO. So after my talk, I hope you try PARO to hold or have PARO. So this is my contents of my talk. First, I'll explain about PARO as a psychophysiological biofeedback medical device in class 2 by the FDA. So PARO seems to be like stuff for animal, but it's a medical device by the FDA. So it's very serious. And there are a lot of clinical trials to show the therapeutic benefit of PARO. And now PARO has been incorporated in some healthcare systems. In the US, for example, PARO can be prescribed for biofeedback therapy, and patients can interact with PARO, and at the time, therapists, nurses, or licensed clinical social workers, or even prescribers, so they may provide biofeedback therapy with PARO. At the time, the cost of time can be reimbursed by the Medicare, Medicaid, and private medical insurance. And also, there are some government funds to cover the cost of PARO for the skilled nursing facilities when they purchase PARO. So PARO is considered as a serious medical device in the US. And in other countries, PARO has been also incorporated in the healthcare systems. And depending on time, I will introduce PARO for children too. PARO is very good for elderly people, but also for children and even for healthy adults. And in Ukraine, there has been an invasion by Russia, and a lot of people evacuated from Ukraine to the surrounding European countries. And now PARO has been used for Ukrainian refugees in Poland. And a lot of children and their family are interacting with PARO, and then PARO improves their PTSD, stress, anxiety, and so on. And also now we are collaborating with UNICEF and also UNIOM. They are United Nations organizations. And I'll briefly talk about it. And also, as I told you, PARO can be used for healthy adults. And now I'm proposing PARO to be a companion for astronauts in the mission to Mars. And we are having some experiments on Earth, not in the space. So I'll briefly show some pictures. So let me show you one video first. This video was created by Japanese government at the cabinet office. And the first portion of the video shows the function of PARO. PARO has many kinds of sensors. PARO responds to touch, talk, some others. And this lady is at a skilled nursing facility in Washington State. She seems to be happy, but without PARO, sometimes she has agitation. She has anxiety or pain or so, then she has some negative behaviors. And with PARO, she always improves her mood and reduce or suppress such negative behaviors. And we can expect to reduce burden of care for caregivers too. And in this facility, they got PARO being supported by the Center for Medicare and Medicaid Services, CMS of the federal government. So they got PARO as like free, being supported by the federal government. In Washington State, there was one big proposal. The 28 skilled nursing facilities got 43 PAROs at the time in 2021. So far there was a shutdown, so we have some influence. And he is a veteran at the VA hospital. So he has PTSD and the dementia. And he also has some behavioral issues, but when he interacts with PARO, he is always happy and do not show negative behaviors. And PARO has been used at pediatric ICU. And they are Ukrainian refugees in Poland, and they are very happy with PARO. This is at a psychiatric hospital in Warsaw. So you may know about animal therapy. So animals are very good. I think a lot of you are having real pets. And there are three kinds of benefit from animal to human beings. First is psychological merit. So interaction with animals cheer the people and motivate people to do something. Second is physiological merit. interaction with animals reduce stress, and also good for rehabilitation. Third is social merit. Interaction or existence of animals encourage communication among the people, and also connect to new people. So animals are really good. And basically, PARO has the same effect. But in the case of real animals, there are some problems of owning or using animals. Some people have allergy, some people are afraid bites and scratch. And there is potential of infection from animal to human beings. And also there are some housing regulation, especially at the elderly facilities and also hospitals. It's really difficult to keep or manage animals there. They may accept visitation, they cannot own animals by themselves. And having animals are very expensive. It costs a lot. So for such people and for such places, PARO can be the second choice. So if people can own real animals, so it's better to have real ones. But if people feel it's difficult or hard to keep animals, then PARO is the second choice. The model of the PARO is a baby half seal in Canada. I visited there and interacted with real baby seal. And the crying sounds are all from seals. Seal is very cute, and also the shape is very attractive to hold. So when we talk about pets, most people talk about dogs and cats. But in the case of dog robot and cat robot, when they interact with such robots, they compare the robots with images of real dogs and cats. And people compare the function of the robot, and the people are disappointed. Because robots cannot satisfy people well. But in the case of seals, as people do not have experiences of interaction, so people can accept PARO much easier. And current PARO is a 9th generation. I have been working on this development since 1993, so more than 30 years now. PARO has many, as for the size, it's about 6 feet. 2 feet. And as for the weight, it's about 6 pounds. So when you hold PARO, you may feel like holding baby or a pet. And PARO has 3 microphones for speech recognition and sound localization. PARO doesn't have CCD camera because of the privacy issue. And the PARO can recognize words. And if you talk to PARO, PARO recognizes your words. They are simple, like greeting words to pet or like animal, baby, but they still, PARO may respond to your talk. PARO has light sensor as simple vision. And inside PARO has posture sensor and temperature sensors. So PARO keeps his own body temperature. And whole body is covered by tactile sensors. So if you stroke PARO recognizes where and how you touch the body of PARO. And as for the fur, it consists of silver iron, Ag+, that can kill bacteria and virus. So it's very good for infection prevention and control. Of course, when people use PARO at facilities like hospitals and nursing homes, still we need to clean the fur by using the disposable wipes. I'll explain a little more about cleaning, the way of cleaning. And the PARO has several actuator systems that move silently. And the PARO has learning functions. Basically, 2 kinds of learning functions. One is name, the other is behaviors. So if you give a new name and call it again and again, PARO gradually learns the name and starts to respond to the new name. And being stroked is good for PARO, and being hit is bad for PARO. So PARO tried to be stroked by the owner. And through interaction with the owner, PARO gradually changed its characters to be liked by the owner. And this is the inside. You don't have to worry about technologies, but there are a lot of technologies inside. And this is a map of Japan. We have a factory of PARO in Toyama. That's the location. And we have very good nature. The area is surrounded by Japanese Alps. And we have ocean. and beautiful mountains, and also cultural and historical places. And in the area, we have long history of production of a lot of artistic things with good craftsmanship. And people are still working on such kind of product. And we learned a lot to produce PARO. So each PARO is handmade. So, for example, as for the PARO's face, each PARO has a slightly different face from others. So PARO is a combination between art and technology. So in terms of art, the quality is very important for PARO to be accepted by people. So a lot of the museums exhibit PARO. So this is the Louvre Museum in Paris, Museum of Modern Art in New York, Cape Branly in Paris. This is Design Museum in London. And this is the Victoria and Albert Museum in London too. And actually they got PARO for collection. Now PARO is on the list of the collection too. It's in Spain, Germany, in Norway. And they opened a new national museum in 2022, and they have been exhibiting PARO there as a kind of art. And PARO has been used in more than 30 countries now, nearly 50 countries actually. So almost everywhere, PARO has been accepted very well. There are about 8,000 PAROs. Japan is the most so far. There are some cultural differences. Japanese people like technologies and also like robots. So half of the users are individuals who purchase PARO as a companion or pet. And they are like senior people. So later I will show one pictures and video. And another half are used for therapy at like hospitals and nursing homes. And in Europe, Denmark was the first adopter of PARO because they had a national project to evaluate PARO in dementia care. And it was since from 2006 to 2008 for 2 years. And they found PARO was very effective. And then they started adopting PARO in the public system. And now about 90% of the municipalities, like local governments, have already adopted PARO. First for elderly people with dementia. But now PARO has been used for facilities for the people with disabilities and also psychiatric problems and so on. And in the UK, PARO is also adopted. And PARO was introduced in NICE guideline. It's a medical guideline on dementia. And as a National Health Service, it's like public hospitals. Of course, they have to have PARO. But if elderly people with dementia have behavioral and psychological symptoms, then first they have to try PARO to improve them. And if PARO doesn't work, they are allowed to use medications, like psychotropic medications. So PARO can replace medications a lot, because medications have a side effect and also problem of addiction. And in the US, PARO, as I said, PARO is a biofeedback medical device. And PARO can be prescribed. But PARO can be a pet for too. For people. And basically, interaction with PARO can improve quality of life, anxiety, pain, depression, sleep, stress, loneliness, pleasure, engagement, and so on. And also improve communication and sociability. And then, such kind of effect can reduce agitation, aggression, walking about, like wandering of the people with dementia, or like developmental disorders, like children. And also that reduce risk of falling. And also reduce burden of care for caregivers or family members. Then reduce psychotropic medications. And this is the pictures in the future of the elderly care in the US. There is one story about PARO. They don't call PARO, but a story about the sea robot. And in Japan, a lot of elderly people, senior people, active senior people purchase PARO as a pet or companion for them. Let me show you one video. This is in Japanese, and then some text in English, and please read that. They are around 70 years old at the time. They take PARO almost everywhere, even at the restaurant, bar, and some others. In Japan, most restaurants do not allow us to have pets inside, but PARO is allowed. And PARO connect people.
ロボットというよりも家族ですね。
The first barrier is the battery charger or PARO.
ロボットと思ったら、あんまり相手もできないと思うし、その抱いてみたって、たかがロボットかなと思うんですけども、やっぱり反応もするし、でこの子学習できるんですよ。こういろいろ教えると。だから私とか子供がいないので、お父さんの2人がいじめたり叩いたりはしないんですけど、いい子には育ってると思うんですけどね。
So they love PARO, but they are basically dog lovers. They used to own 3 dogs, and they still have 4 dogs. And in Buddhism way, they mourn for the 3 dogs which they passed away. And that's 4th dog. Its name is PARO, not PARO, PARO. And it's very old. Yeah, they spend a lot for medical treatment and also some, baby care. They don't have any cognitive development. They are very fine.
どこでも OK でしょ、入れてくる。ワンちゃんの後でいろいろ入れてくれないお店がたくさんありますし、まして旅行なんか全然ダメでしょ。で、この子だったら旅行だってどこだって行けますから、お父さんともタルちゃんを送ったらどんどん出ていこうと言ってるんですけどね。ワンちゃんはやっぱり行けませんからね、預けることが利用しないんで、自分で見ないと嫌なものなんで。だからもう絶対預けるのが嫌だから私はもうずっと行かなかったですけどね。あとはタルちゃんがちょっと見送ってしたらあとは3人ですね。
So how is PARO was counted as one of family members?
人生また探しますね。もう飼いませんけどね、ワンちゃんたちはもうよく飼いませんね。この先私より残されて私が先死んだ時に困りますからね。
But now, so as for Japan, we have more and more elderly people, and we have also the Japanese society is considered as a super aging age society. So now nearly 30% of Japanese population is more than 65 years old. And a lot of people are healthy, but some people need some care because of the dementia or some other physical disabilities. But a lot of countries are becoming aging society. So by 2050, most countries except in Africa become aging society. And dementia is a very big issue. In the world, now there are about 50 million people who are suffering from dementia. And the number is increasing. So by 2030, it will become 75 million. And as for the cost of the medical and welfare treatment, now it's considered about $1 trillion US. And by 2030, it will become double, like $2 trillion US. And this is a case of the severe dementia. He cannot speak well, so he has aphasia. always screaming that way. Now therapist brought PARO and gave it to the person, a patient. And first he stopped screaming. And he started to talk to PARO. PARO stimulated his brain. It's in Italian. Then now he can communicate with the therapist. And then he expressed himself to the therapist. Now therapist understand what is the problem or what is the reason for anxiety and so on. But gradually, the patient improved his mood and he has smiled. And at the time, the therapist wanted to calm him down in order to take him to lunch. So before lunch, before dinner, before bathing, when they need to calm him down, they use PARO as like a switch. And before having PARO at that facility, they gave psychotropic medication to the patient. But it takes about 30 minutes or so to have the effect. And if the patient has a psychotropic medication, sometimes both they become sleepy. And now he is sitting on the wheelchair, but because of the sleepy condition, he may be falling down from the wheelchair. So after giving medication, someone has to be with the patient. So that means the caregiver or someone will be taken for about 30 minutes. But with PARO, it takes only a few minutes to calm him down. So it's much easier, and there's no side effect. The next one is wandering. So when people become dementia, especially ladies tend to want to go back to home in the evening, late afternoon. It's called sundown syndrome. So the ladies want to go back to home to prepare for dinner. So they feel anxiety in the evening. And then the lady was talking about. And she has PARO. And now the therapist gave the PARO to the lady. And the lady started to practice PARO. She has a nice smile. And she improved her mood and reduced anxiety. Then she doesn't have a reason to go back to home. So she stopped the wandering. There are a lot of people who stop wandering by interaction with PARO. The wandering has some reasons. The interaction with PARO can include such kind of reasons. The next one is a case of the Parkinson's disease. So there is a lady, she has a kind of tremor. She cannot control her body well. But when she interacts with PARO, her legs are moving a little, her upper body was well controlled, and she has a nice smile. So when people interact with PARO, we can assume that the lady had some kind of more dopamine in the brain, and that can stimulate the kind of function of the movements. And this is a case of recovery of speech. So there is a picture on the left. The lady is interacting with PARO. And she was originally from Eastern Europe and immigrated to Denmark. And before becoming Alzheimer's disease, she spoke 2 languages. the Danish and original language. But after becoming Alzheimer's disease, she couldn't speak the Danish, only the original language. So it was the facility in Denmark. So caregivers are talking only in Danish. So they couldn't communicate with her. But when she interacted with PARO, she talked to PARO in Danish. And at the time, the therapist or caregivers can communicate with her in Danish. So I took these pictures and I saw the phenomenon. Then when the caregivers or therapists want to talk with her, they bring PARO and let her interact with PARO and switch on the Danish. Then they have communication. But when we removed the PARO from her, she couldn't speak Danish again, gradually. So PARO has very good stimulation to the brain to activate her speech function. And that can recover the Danish language. And the next one is a kind of recent result of the clinical trial of PARO for the elderly people with mild dementia. And there are two groups. One group interacted with PARO for 1 hour at a day care center. The elderly people are living at home. And another group had art therapy. So they also had one hour art therapy per week. And they had 6 weeks of treatment. And after 6 weeks later, there are four more weeks. At the time, both groups didn't have anything. So this is, there are a lot of good results, but this is very important. Upper left one. So MMSE is a score of the cognitive levels. So when people, the maximum score is 30. So when people have like around 20 or so, people are considered as like mild dementia. And then both groups had improvement for 6 weeks. But as for the art therapy group, they have declining of the cognitive levels. But in the case of the PARO group, they continue to improve or kept the cognitive levels. So that means interaction with PARO stimulates human brain to keep or improve the cognitive levels. And of course, in the case of the Alzheimer's disease, even from 30 years, like 30s, we have some declining of the function of the kind of accumulation of the tau that they are considered as reasons for Alzheimer's disease. So gradually, we have some kind of deterioration in the brain. But if we can keep cognitive levels, even if we become Alzheimer's disease, we can live fine. So keeping cognitive functions are very important, especially for the elderly people who have mild cognitive impairment or mild dementia. If they are living at home and if they can keep their cognitive levels, they can continue to live at home. If they have some deterioration, decrease of the functions, they will need to move to the dementia care unit. And at the time, they have to pay about $70,000 to $40,000 US dollars per month for dementia care unit. That's very expensive. There are many other measurements. And this is one of the results of the randomized control trial. It's also a clinical trial for PARO for dementia by University of Texas and Baylor Scott and White. Baylor Scott and White, that's a kind of medical group. There are 61 people at 5 dementia care units. They were divided into 2 groups, with PARO group and ordinary treatment group, like music therapy or some others. And with PARO group, most groups had one session for 20 minutes, 3 times a week for 12 weeks, like 3 months. And with PARO group improved anxiety, depression, pain, and stress significantly. And also they reduced the medication as needed for anxiety, like 30%. And PARO's effect continued for 5 hours. That is 2 hours longer than the medications. So at the elderly facility, they spend a lot for medications, but we can reduce or avoid such dosage of medications. So there some physical measurements. And they also show such a positive effects. People reduce stress and also anxiety. There are a lot of clinical evidence, but they are very complex, so I'll skip many slides. There are many clinical trials of PARO. But basically, those results show the improvement of the behavior and psychological symptoms of neurocognitive disorders like dementia, like including agitation, depression, and others. And also, PARO can be effective both individual session, like one-on-one session, and also group session, one PARO with multiple people. Either is fine. Yeah, I skipped slides. So in Australia, they found PARO as very effective, and a lot of facilities purchased or introduced PARO. There are many. And in 2023, University of Singapore looked for the clinical trials of PARO and papers, and they found about 900 papers on PARO in the cases of people with dementia. And they found 12 papers on randomized control trial that is very strict evaluation. But basically, the interaction with PARO improved behavior and psychological symptoms of dementia and also sociability, and also reduced medication, dosage of medication. So basically, in the US, patients with dementia, cancer, PTSD, brain injury, Parkinson's disease, and developmental disorders, and so on. Then if they are diagnosed as pain, anxiety, depression, insomnia, agitation, or so on. Then biofeedback therapy with PARO can be prescribed with some CPT codes. Then Medicare and Medicaid, and also private medical insurance can accept reimbursement. So this is one of the examples of prescription in the case of depression. So one session is 20 minutes for 3 times for 3 months. This is a case of insomnia. 20 minutes one session before going to bed. People can sleep better. And the cognitive communication deficit. And so the patient have difficult behavioral issues. Then 20 minutes twice a day, and also PRN. That means when they need to use PARO, they can use PARO. PARO can be also used for rehabilitation. So when people stop PARO, for example, even if people feel pain, they may move their arms. Then that is very good for rehabilitation. And even people talk to PARO, that's very good for speech therapy. So talking to PARO or talking with others are very important to keep the function of swallowing. Swallowing is very important because if you eat something and if you have less function of swallowing, you may have some problem. So, yeah, I can't tell you that, but the swallowing is very important. That means talking very much is very important. I skip this. And then PARO can be used for cancer patients during the chemotherapy, for example. As for chemotherapy, there's some necessary medication, but PARO can combine with such necessary medication because there is no conflict or crossover between the medication and PARO. And PARO has been used for the elderly people in acute care hospital. And the University of Pennsylvania evaluated the effect. And they found that interaction with PARO improved agitation. Patients are elderly people with dementia and or delirium. Delirium is very difficult. There is no medication for delirium. But interaction with PARO improved the agitation in 20 minutes and the pain in 60 minutes after the surgery. So PARO was very, very effective. And they have been using PARO since 2019, even during the COVID-19 pandemic. And then, so PARO, it has very long life and also PARO is very safe. PARO can be used at such a very strict condition. And now we are having a new clinical trial of PARO at the emergency department of Brigham and Women's Hospital with Harvard Medical School. So when patients arrive at the emergency department by ambulance or by walk, so usually they have to wait about 13 hours to get a bed. It's very long time. And there's almost no treatment. So people are crying or people are screaming because of pain, anxiety, or so. So they have agitation. So also accompanying person like family members or friends, they feel very bad. But during such a waiting time, we try to use PARO and improve their conditions. We are still collecting the data, but so far we have some good results. So in the UK, it's in Oxford, some slides. And if you have to use PARO as a hospital or even like veterans hospitals in the US, 2 minutes of cleaning by disposable wipes, which is for cleaning and disinfection, that can keep PARO clean and disinfected. And the protocol was approved by the VA hospitals in the US, and also NHS, National Health Service hospitals in the UK. So this picture was taken in August 2020, here just at the beginning of the COVID-19 pandemic. Left person is a medical doctor. He was not allowed to touch the patient directly, but PARO was allowed to interact with the patient at the hospital, national hospital. And in France, PARO was evaluated by the University of Paris medical school, and PARO got award in 2015. And then in 2018, the French government stopped covering the cost of the medication for slowing down the Alzheimer's disease or dementia. And then they started to use PARO in the elderly facilities. And now, when PARO is purchased at the elderly facilities, the local government, state government, cover all the cost of PARO for them. And we have more and more use of PARO there. So people are very happy with PARO. And there are some use for children. PARO has been used for children with developmental disorders such as autism, ADHD, and also Down syndrome and so on. This is the case of Stanford University, and they found PARO improved anxiety and pain. And this is ICU. So we cannot bring around us to the ICU, but the PARO was allowed. It's UC San Francisco. I skip many slides. And in Japan, we have many huge aspects. And after that, a lot of people evacuated to the shelters. And at the time, we brought PARO, and they were very happy with PARO. So PARO improved their depression, anxiety, and so on. And on January 1st in 2024, we had another huge earthquake in Noto Peninsula. And so we are allowed to bring PARO there, and now PARO is used for the elderly people with dementia and also for caregivers. Caregivers have burden of care because of caring elderly people with dementia, but also they have very bad life because they are also victims of the earthquake. Some people are living at temporary houses, so they have a lot of stress. But we expect PARO improves their stress. And, yeah, this is the case of the Ukrainian refugees. So, a lot of countries supported Ukraine by providing weapons. But as for Japan, we cannot provide such weapons. So I thought PARO would be a very good tool to support them. And so we're collaborating with Japanese embassy and also JETRO in Warsaw. So first, 4 PAROs were donated to 2 medical organizations. And the PARO was well accepted, and a lot of Ukrainian refugees are very happy with PARO. Then there are some more demands. And after a while, the UNIN, like UN Migration, wanted to use PARO for Ukrainian refugees at therapy center, a therapy room at the family support centers. And there are about 2,000 Ukrainian refugees at 8 family support centers, and all have been well accepted there. And also, UNICEF wanted to use PARO at 7 student huts. That is a kind of daycare center or day center. There are 6 or 7 cities where student huts have been using PARO. And at one center, about 1,000 refugees are using PARO for 1 year. And let me move to the space. And I used to work for the MIT AI lab with Professor Donald Brooks. And he is very famous with the idol of Roomba. He created Roomba. And in 1997, he designed a robot for the Mars rover robot, which was called Sojourner. And so his robot was sent to Mars, and that was the first robot on Mars. So I found, Mars is very interesting. And in the future, if people go to Mars, probably PARO or such kind of robot would be very important. That was the motivation to think of this. And it takes about half a year to get there. And in the first mission, astronauts are expected to be there for 2 years. And there's another half year. So first mission may be about 3 years. But there is a long distance, and so there is a time delay in communication, about 20 minutes. So they are isolated in that sense. So PARO to improve their stress by mission and also isolation. And also that will reduce risk of mistakes. In the past, kangaroo was taken as a pet for like Australian and New Zealand tourists. And I had a meeting with NASA and exhibited PARO at some space conferences. A lot of people think that mental health is very important. And I had an opportunity to talk with folk at NASA. Sorry, I skipped page slides. And we had some analog mission on us in Utah. It's Arizona, it's Poland. And the result was presented in one conference by NASA. This is in Hawaii. So we are having fun with PARO. Thank you very much.
How much does PARO cost without insurance?
Yes, so far the cost of PARO is not covered by the insurance. And the PARO is $6,000 US by the PARO Robots US in Icaster.
Can individuals purchase it, and if so, how do they do so?
Yes, so.
So, my name is Jane again. So our office is actually in Itasca. So whenever you need it, we have my cars over there on the counter. You can grab my car, you can email me or call me anytime that you need to inquiry about how PARO works, or if you'd like to purchase it, I can give you some pricing information or research paper if you're interested in. Hope that answer your questions.
Since PARO can be used in many institutional settings, how do you clean them?
Yes, so basically in the US, the team has the BDI Sonic clothes that the wet pack disposable wipes. And 2 minutes of cleaning by the wipes can keep PARO's fur clean and disinfected. And after drying the fur, you need to brush the fur in order to keep a good texture. Yeah, for example, at the VA hospitals or some facilities, they have some standard like those bikes, and we can use them.
Thank you. Well, thank you so much for your presentation, and thank you for all those wonderful statistics. Warms the cockles of my heart to see there's been a lot of research done that shows the effectiveness of the PARO. Does PARO, is that an acronym for something?
Yes, there are two reasons of the name of PARO. One is the PARO stands for the sound of a personal robot. Of course, the spelling is PER, but the sound is like PA, so I have chosen PA as a first sound. And also, the breaking sound like pa or ba, they can be easily remembered by people. So that's a psychological effect. So I have chosen pa as a first sound, and then PARO, personal robot. Yeah. Thank you.
What type of ongoing maintenance does PARO need? It looks like they need to be charged through their nose or something, but also, yeah, or like a pacifier, or what type?
Yes.
And internally, if something happens to them when they're on a spaceship.
So basically, PARO is very robust. If I drop PARO here, PARO can survive. So actually, inside, PARO is bulletproof. That means PARO consists of the polycarbonate inside, and it's very strong. And also, here is a switch. You cannot see, but if you touch the switch, like 1 inch deep, 1 inch below from the top, and then you can feel the switch if you touch here. And now PARO is sleeping, and if I touch the switch again, PARO will wake up. They are the major technical issue. And this is pacifier. And if
So there's a pacifier for PARO to get charged. So usually about 2 hours charging can last for like 5 to 8 hours usage. And we have users that have been using PARO for over 10 years. And still working.
yes, PARO is very robust.
You can send this to our office in Itasca. So it's pretty close.
There is a PARO clinic in Lancaster. PARO robots have the PARO clinic.
We have extended warranty. You can send it back. We can do the per-off cleaning if it's too dirty and send it for dry cleaning.
Are we going to have a chance to touch PARO?
Yes, so after this the closing the session, you have the chance to interact with PARO.
They can bring PARO down to the living room. And when you're down for your coffee and your goodie, I think they'd be very happy to bring PARO down there for you to touch him. He's really sweet. I had the opportunity. Is there any more questions? Okay.
When you had PARO up there, was he responding to the voices coming over the mics?
So PARO has speech recognition and sound localization. So if you talk to PARO, or PARO recognize voice. And in the US, PARO recognize English. In Japan, Japanese.
But I mean, they were motionless, but then when people started talking, they started reacting. So are they responding to our voices?
PARO is responding to voice. The reaction is not always the same. Yeah.
Are they using these in hospitals in Chicago? Like in the children's hospitals, and are they in use right now?
Not in Chicago yet, but we have it in Nebraska, San Francisco.
Okay, and why is that? Why aren't they using hospitals in Chicago?
I think there are more strict rules in Chicago. So I feel like West Coast is more open to those robotics.
Okay.
I think it takes takes time for PARO to be accepted, the medical professionals. Yeah, so that's why we are accumulating a lot of clinical evidence.
Okay, so if I own one and I had a child in the hospital, I couldn't bring it in?
Yes. You have to talk with a hospital.
Oh.
Yeah, but basically it should be okay.
Oh.
You know, the seal in Europe speaks 5 languages. The one in the US just speaks English. So there's so much to learn with them, and maybe you can talk an organization into trying it.